Reading a pituitary MRI can feel difficult because the gland is small and requires a systematic approach. In this video, I will show you how to read a normal pituitary MRI, its protocol, and step-by-step radiological guide to diagnose or to identify the normal pituitary gland, which is very essential for the exam purpose and also for the reporting purpose. So be with me for few minutes and you will master about the pituitary gland and its MRI. Start with the correct protocol. A standard pituitary MRI protocol includes thin slice T1 sagittal, thin slice T1 coronal, T2 coronal images, dynamic contrast T1 images. So this includes the coronal images, and images are taken at different time frame after giving the contrast, and then the post contrast T1 sagittal and coronal images. So these are the protocol for the MRI of pituitary gland. So thin slice include the 2 to 3 mm slice thickness. It is essential because the microadenomas are very tiny and they may be missed in thick sections. So thin sections are taken for pituitary protocol. Now the anatomy. First begin with the bony anatomy, that is the sella turcica. Sella turcica, we can see this is the lateral radiograph. This is the sella turcica denoted by this circle, and it has the anterior wall, that is the tuberculum sella. This is the anterior wall. We can see better in this CT image, sagittal image. This is the tuberculum sella. Posterior wall is the dorsum sella. Inferior floor called the sella turcica, and the superior wall which is formed by the dura mater. So this is called the diaphragma sellae. So this is the boundary of the sella turcica, and we see for the normal size, expansion, erosion of sella. So its normal size is the vertical height is 4 to 12 mm. We can see this is the vertical height in CT. This is the vertical height. Normal range is 4 to 12 mm, and AP anterior posterior diameter is the 5 to 16 mm. So this is taken in lateral radiograph or sagittal CT image. Sella should not be enlarged or destroyed. If it is enlarged or shape is altered, then think of some pathology. Now the contents of sella turcica or pituitary fossa are the pituitary gland and its vessel. So main content is the pituitary gland, that is the anterior and posterior, that is the these two lobes of pituitary gland, and the vessel supply the pituitary gland. So these are the main content of the pituitary fossa or sella turcica. Now the shape of the gland. So normal superior margin may be flat, mildly convex, or slightly concave. So depending on the age of patient, it could be the flat, convex, or concave. You can see here upper image shows slightly convexity, whereas the lower image shows the flat upper surface of the pituitary gland. And if it is markedly convex or focal bulge, then think of the pathology, or most common is the pituitary adenoma. So we can see here there is convexity in the upper margin of the pituitary gland. So this is due to the adenoma. Now the size of pituitary gland. Depending on the age, it varies. Like infant and children has 6 mm size, whereas the postmenopausal women and adult men has the 8 mm size, and childbearing age women has the 10 mm size, whereas the late pregnancy and postpartum period shows the 12 mm pituitary gland size. So depending on the size, 6 mm and 8 mm has the concave or flat border, whereas the 10 mm and 12 mm has convex border. So convex superior border. So this is called the Elster's rule or 6, 8, 10, 12 rule. This is very important because the size depends on the age, and this should not be confused with the pathology. There is a very important feature of pituitary gland seen in T1 weighted image, that is the posterior pituitary bright spot. We can see here this is a small bright spot in posterior pituitary. This represents the normal neurohypophysis, and it contains the storage granules, that is the hormone produced in thalamus is stored in the neurohypophysis, and this is the normal physiological phenomena. So this appears bright on T1 weighted image. If it's absent, think of the diabetes insipidus, stalk lesion, or hypophysitis. And enhancement of the pituitary gland is homogeneous. So we can see here the pituitary gland is homogeneously enhanced, including the infundibulum. Now the pituitary stalk or infundibulum. So it is a midline structure. We can see here, this is the infundibulum. This is a midline structure. It is a thin structure. So we can see here it is a thin, and it is centrally located in pituitary gland, arising from the superior surface of the pituitary gland, and it connects the pituitary gland with the hypothalamus. So its size is 3 mm or 3 to 4 mm maximum thickness. If it is more than that, then think of the pathology, and it shows the normal homogeneous enhancement in post contrast study. This is the representative image, and this is the MRI image sagittal section. We can see this is the infundibulum connecting the hypothalamus with the pituitary gland, and it is located centrally. So this is the infundibulum. Now the relation of sella turcica or pituitary fossa. Superior relation is the optic chiasm. We can see here, this is the optic chiasm. We can see in this sagittal image, this is the optic chiasm superiorly. Hypothalamus, this is the hypothalamus. In this we can see this is the hypothalamus, and suprasellar cistern on either. This is the suprasellar cistern. We can see here, this is the suprasellar cistern. So these are the superior relation. On either side, that is the laterally, on either side there is a cavernous sinuses. So these are the cavernous sinuses containing the cavernous part of the ICA, and these are the cranial nerves, cranial nerve 3, 4, and V1, V2 segment of cranial nerve 5 and cranial nerve 6. So these are the cavernous sinus on either side. Posteriorly the dorsum sella and clivus, and then the basilar artery and brainstem, and anteriorly the tuberculum sella and sphenoid sinus, and inferiorly the sphenoid sinus. So these are the relation of the sella turcica or pituitary gland, and these are the normal, and pathology in this region can also affect the sella turcica. Now the quick review for the normal checklist. For the sella turcica, see for the size and shape of the sella turcica. For pituitary gland, shape, size, and posterior bright spot, stalk, and enhancement of the pituitary gland. And also see for the relation of the pituitary gland or sella turcica, suprasellar region, on either side lateral relation, that is the cavernous size, and inferior relation, sphenoid sinuses. Now these are my references, and this is all about the normal MRI of pituitary gland. And if you like this video, then like, share, and subscribe my channel to get more such video. Thank you for watching.